Okay, here we have a postero-anterior chest radiograph of a skeletally immature patient taken in expiration. The first thing that catches my attention is an area of increased transradiancy within the right lung, which seems to involve the entire lower zone. There's a sharply defined upper border, which I believe to be the displaced horizontal fissure. Now, when I compare the right lung with the left, I notice that the left lung and right upper lobe are of uniform density, which is what we expect to see in an expiratory radiograph. There's no evidence of volume loss or consolidation. The mediastinal contour looks normal, and the thoracic wall is also normal. The findings suggest partial obstruction of the bronchus intermedius. Typically, correlation with the clinical history would be incredibly helpful here, but based on the radiographic appearance alone, I'm leaning towards the most likely cause being an aspirated foreign body or mucus plugging. Now, foreign body aspiration, especially in children, can often present this way. Kids tend to aspirate objects like peanuts or small toys. This radiograph is suggesting air trapping in the right middle and lower lobes, which is a classic pattern for a radiolucent foreign body. With no other features of airways disease visible on the radiograph, I would favor a foreign body being the cause. If this were my case, I'd urgently discuss the findings with the referring clinicians and suggest bronchoscopy to directly visualize the bronchus intermedius, with the aim of possibly retrieving the object if, indeed, it's a foreign body. Bronchoscopy can be both diagnostic and therapeutic in such cases. At this point, based on the radiographic findings and clinical suspicion, the diagnosis I'd go with is air trapping in the right middle and lower lobes, likely secondary to an aspirated foreign body in the bronchus intermedius. In a child, this could very well be something like a peanut. So to summarize, this case highlights the importance of recognizing air trapping and foreign body aspiration in pediatric patients. The sharp demarcation of the horizontal fissure and the right-sided transradiancy give us clues about the location of the obstruction, which we suspect to be the bronchus intermedius. A thorough clinical correlation and follow-up bronchoscopy are essential for management. That's the case. Thanks for tuning into this discussion. For more radiology cases and in-depth learning like this, make sure you subscribe to Radiology Made Easy. Keep practicing those cases, and I'll see you in the next one.